Hello. This is Dr. Ahmed Magable. We will talk in this session about speaking in detail just to give you some point of view about it. First of all, you have to know that speaking is what is the easiest subtest of all subtests of all subtests, and it's always about five things that, of course, on the resources that I'm saying right now is from the OET itself. You will be evaluated in OET in five basic things. The first thing is the overall communicative effectiveness. Let me just ignore the second one for something in my mind that I will tell you later on. The second thing is fluency. The third thing is appropriateness, and the fifth one is resources of grammar and expression. But if you ask me, what is the most important thing that you just play as a maestro with it is the intelligibility. You have to be smart. It's just like that you are a captain for let's say for a plan, and you just for a plane, and you just making and you might just you are the controller to talk. Okay, so this is very important. We will, of course, first of all, we will discuss the construction of the exam itself. First of all, the exam is about 20 minutes. The first 2 to 3 minutes will be icebreaking question. The icebreaker question, you will be asked this specific question that has to be customized by you. Why you are taking the OET exam, how long you have been working as a physician, and etc. A physician or in nursing, and etc. But in the end of the day, is very customized to you, and this question will not be evaluated in your speaking. It's just to break the tension that you feel in the beginning of the exam. After that, you will be given a schedule, that you'll be given a card just like this, that your profession will be in the left side of it. Okay, so you have to make sure that your profession is just like here, and there will be a paragraph with the multiple tasks that you have to achieve. So what is the importance of this paragraph? Well, there is a rule that you should not use any of the patient's detail or medical history. You just ignore them. The only important thing is that you have to know from this paragraph that if this patient have his second visit right now, or you are dealing with him from when you are dealing with him, since when you are dealing with him, since half an hour, since an hour, you just see him, because it's just make difference in how you begin with talking. So it's just like that. Well, good afternoon. I hope nice to meet you again, Mr. Is of course you are predicted that it's a follow up. So again, good morning or good afternoon. My name is Dr. Ahmed Magable. I'm your physician for today. Can I confirm your name and age, please? This is if the first time you've seen it, like in the emergency room, or it's the first time that she's visiting you. Okay, and sometimes they just said after you examine the patient, you are now presuming. Of course, I will begin with that. I will begin that. Well, good afternoon, Mr. And we will Mr. Let's say Mr. Muhammad. After we examined you, there is just, and you just begin with the first task. Of course, the things that you will be asked and you will be evaluated on, that how you deal with this task. Some tasks have, and they are what they are doing right now, OET, and as we will practice in the last, as I said, in the last 4 to 5 months, on the cards of the 4 to 5 months, in the past 4 to 5 months, sorry, we will practice that OET is trying to make a multiple and different task, and even the single point. When I say a point, I'm saying about this. The single point has multiple has a multiple task. It's just what the thing and multiple orders. What I'm telling you about order, what is the definition? Is that verb, tell, explain, express. So of course, you will be before we begin with speaking, you have to memorize these three schedules, which are so easy, okay, and which are so easy to memorize, and they just give you some kind of expression, because you will not say a word outside the card, okay. You will not say a word, I mean a clinical or a medical information outside this card. So yes, you have to remember this three schedule that we have here before we start training, okay. And as I said, you will be given 3 minutes to read all the card, not the card of the carer. The card of the carer will be in the hand of the one who is making a role play with you, and he will not be evaluating you, okay. It will be recorded and it will be sent to Australia to evaluate you on that, okay. So we will discuss in details how we can benefit from each second of the 3 minutes that they were given us in the first of the exam, after the ice-breaking question, okay. And of course we will discuss after the 3 minutes you will be given 5 minutes to make the role play with the patient, okay, or the one who come in behalf of the patient, okay. We will talk about that thoroughly. We will talk how you deal with this as we say, with these orders: express, explain, tell. Then you go and move forward. Let me show you some tasks that it's really long, and that's what OET is doing. And if it's long, well, I will become so happy, because you will end on the 5 minutes and you will not have extra time to make something that we call summarization, okay. Because we will try to use the point itself to talk, like if I want to talk about this point, you think that is too long. Well, the thing is more than easy. Then what I will say is that for example, is that, well, Mr. Ahmed, I just want to explain that the threshold of the raised glucose values on 2 occasions are more than enough that is determined by the WHO as evidence for that you have DM, for diagnosing DM. That's just is as easy as that, okay. And you just move on and you move on and move on until you end your task, what you are told about, and that's it. So of course in the online session we will talk more and more about it. I will practice with each one of you in the live session, and after that each one of you will have a 15 minute weekly to practice with me online until his or her until your exam. So and before your exam in 3 days, you will have a session with me to recap with you all the skills that you need in your exam. So I hope that everyone has benefit from this video, and I hope that I see you in the live sessions. Thank you.